Thank you for watching today's online seminar, The Forefront of Accepting Foreign Human Resources from the Field of Children, Employment and Health. This is the last session of the seminar. The theme is Communication in Healthcare.
コロナ禍以前の問題が
Even before COVID-19, there were problems.
当然外国人
Number of foreign residents are rising, and 230,000 people are not registered in the Basic Resident Register, and 80,000 people are overstaying. There are some who don't have health insurance, who don't speak Japanese nor English. Thirdly, without health insurance, people are denied access to various public services. Some were declined to see a doctor during COVID simply due to no health insurance, but technically you can see a doctor, but it turns out the other way.
そうじゃないんですけどっていうことがもう一つは
And some foreign residents have financial woes. Although different in degree, few medical institutions are practicing support.
ないのという問題があります何が
So what happened? First, people lost their jobs. In fact, those who came as technical interns also lost their jobs, consequently lost their status, which forced them to live in a shared small space and became prone to COVID.
ますからそこでコロナが
Without health insurance, they have nowhere to go, leading to clusters. Naturally, they can't get the tests nor medical care. Christmas and New Year's get-together caused outbreak among them too.
当然検査診療を受けられませんさらに実はいろんな祭り等がありますよねそういう時みん
And
な
another thing which is becoming apparent is that people may be reported to the immigration authority if they were found without a status of residence.
でもう一つは在留資格を持たない場合は通報されるというような問題が顕在化してきましたまずしっかり
First, I want to make sure to deliver information to the community. Secondly, it is not enough just with us information. We need to create a system to connect people. Thirdly, we want not only those relevant, but also the people in Japan, especially those in the medical field, to be aware of the fact, as there are many people who do not know about these issues. These are our three pillars of action.
成果として行いますまず最初にやったのは
The first thing we did was, as I told you before, the foreign community does not actually access websites. They hardly look at it. So even if the local government posts information, they are not aware. Their source of information is Facebook. There are influencers with 800,000 followers, so that's the place to share information.
実は政府からもこういう
In fact, the government has issued a notice to foreign residents to get vaccinated, but it is difficult to get the word out.
で実際それがなかなか伝わってないのが現状です。
このような新型コロナ
COVID-19 poses high risk for individuals if measures are not taken, and it can spread to communities and eventually to the whole of Japan. We need to think about how Japanese society should tackle this issue.
日本社会が取り組んでいくべきなのかなっていうところについては非常に考えていかないといけない部分なんじゃないかなっていうふうに感じました。
まずですね、この時期ですね。
Clusters among foreign residents happened frequently during this period. This not only happened in Japan, but similar clusters of foreign workers happened in Germany, Spain, and Singapore. I suspect that this is because they inevitably have a difficult housing and working environment.
もしくは労働環境が非常に厳しい状況がある、そのような状況で、起こっているんじゃないかということ。外国の方の4人から
This is a result of a survey that showed 1 out of every 4 to 5 foreigners have problems at medical facilities. About 24.1% of the respondents said that they were not able to accurately report their symptoms at the hospital. It is important to note that more than half of the respondents have no trouble speaking Japanese. There are two groups, those who have no problems with Japanese and those who do, and the data shows that the latter is actually the
そう
minority.
でないグループがマイノリティで実はあるということをこのデータが示しています。外国人労働者と
This is a relationship between foreign workers and industrial accidents. As you may know, work-related accidents among foreign workers are twice as high as those among Japanese workers. This may be valuable information for Toyota and others.
非常に貴重な情報かもしれませんけど、特にですね、技能実習生
It is said that workplace accidents are especially high for technical interns. However, it is actually higher for settled residents and permanent residents rather than technical interns. There are two age groups, young people and middle-aged people. The biggest issue is that many industrial accidents involving foreign workers are especially high in the manufacturing industry. Normally, the construction industry and agriculture are the highest, but in this case, it is happening in manufacturing. I plan to publicize this.
その他を含めて発表予定です。まずは医療
The first thing we need to do is to increase the awareness of medical interpreters in medical institutions, then establish it as a profession. By this, we hope it will lead to providing safe and secure medical care to all patients. This is our goal for the next 3 years, including the timetable for this fiscal year. This year, we will conduct questionnaires at medical institutions, prepare training manuals, and conduct on-the-job training, which is now online. Next year, we will hold an interim report symposium and prepare for OJT for the year after next. It could be difficult under COVID situation, but we will steadily make our way.
実施をしていければと考えています。
どこまでが通訳
What are the duties and the scope of work for interpreters?
なのかっていうところが
They should not only be able to convert Japanese into English and into other languages, but they also need to have the knowledge of Japanese medical system to be able to communicate to patients of different nationalities.
仕組みっていうのを外国人患者にも伝えられるような
They also need to know the medical situation of other countries too, so they can explain the differences with Japan.
医療状況を多少ないとも知っておいた方がその日本の医療との違いっていうところが分かるのかなっていうふうに感じました。
在留資格というものが
If people have status of residence, they will have health insurance, so they can get tests and medical care quickly. That is what we observed during COVID outbreak. However, for example, it is difficult for technical interns whose qualification expired, asylum seekers or asylum seekers on provisional release, and people who are overstaying from the first place. They don't go to medical institutions because they know they won't be able to see a doctor.
受けられないってこと分かってるから行かないということがあると思う。特にやっぱり先ほど
If they happen to receive medical care without the insurance, they will be asked to pay 200 to 300% of the medical fee instead of the usual 70% covered by the insurance. This is a negative effect of medical tourism. Since rich foreign tourists started visiting Japanese hospitals, the cost of medical treatment is now 200 to 300% of what it used to be 100% for them. Because hospitals cannot distinguish rich to poor among foreigners, we have to at least make the medical fee 100%.
これをなんとかしない限りなかなか少なくとも 100% で診療するようにしてほしいというそこの人たちが課題であると考えています。
基本的にはその
The basic premise of our activities is to work with all people and do so in an inclusive manner. It may be close to the question of why we need these kinds of qualifications for medical interpreters. Since the pandemic, online interpretation increased to prevent the spread of infection. Of course, there are many NPOs and so forth doing their best with their own educational systems, and we should respect them as pioneers.
NPO も含めて、独自の教育制度で、頑張っている団体も多いですし、今そういう、方々
However, if we think of medical interpreting, I would like to think of it as a qualification that can be used throughout Japan, even if, for example, the interpreter changes a dress. Right now, the practice is limited to certain groups, so I would like to expand their abilities and open their potential.
例えば住所が変わったりとかしてもですね、通用をする、資格として考えたいこと。現在では、特定の団体の中でという形になってしまうので、もっとその方々の能力というのを、やはり、広げる、可能性を残してあげたいと。基本的にコミュニティ通訳
Community interpreting and medical interpreting are basically different by the international standard of ISO that was mentioned earlier. This time, there were many explanations of systems of government offices and local health centers rather than within hospitals.
官庁またあとはその、保健所からのそのシステムの説明 が多かったので、こういう部分は実は、
In these areas, I believe general public has community interpreters as counterparts, just as medical professionals have medical interpreters as counterpart. I don't know about that since I don't have the data. Basically, I think a lot of things were handled by community interpreters.
それが回答でありますが、基本的には多くの事象はコミュニティ通訳で対応できたと考えています。
コロナということもあ
We
り、
need to respond quickly because of the pandemic. Normally, if the site requires interpretation, for instance, tuberculosis, it takes time to coordinate interpreters to be on site, asking them by saying, please go to the hospital because there are people like this and that.
今回の場合はまず
This time, there was no time at all at the local health center, so hardly no interpretation service were provided for COVID there. I'm sure the centers wanted to, but they couldn't. Instead, the community interpretation was conducted.
それができなかったのが1点と、でその代わりにコミュニティにおけるその通訳が行われたんだと思います。
私もそういった日本に住んで
As I have been involved in the medical care of foreign residents living in Japan, COVID has made it very clear of what I have always been thinking of about establishing a better medical system. Under this pandemic, where many people need medical care, voices calling for establishment of a more robust medical system for the Japanese were heard. Some may think, with no time to spare, the priority is inclined to the Japanese people. Therefore, dealing with foreign residents are of secondary issue.
一部もしかしたらあるのかもしれませんけれども、やはり山田さんもおっしゃってる
But as Yamada-san mentioned, this is about coexistence. By making it easier for foreign residents in Japan to receive medical care and improving the situation, I believe that will evolve the Japanese society as a whole and overcome its problems. I would love to have an opportunity to listen to such activities.
進んでいけるっていうことなんじゃないかなと思っていますので、ぜひそういった活動、またお話聞ける機会があればなと思っております。
改めまして登壇の
Once again, I would like to thank all the speakers and YouTube viewers for joining us today. Thank you.